Hello, and welcome to this session of Essential Together, a program that seeks to support the safe reintegration of caregivers as essential care partners. My name is Carol Fancott, and I'm the Director of Patient Engagement and Partnerships at Healthcare Excellence Canada. Joining me on today's session is Adrienne Zarum, one of HEC's embedded patient partners. Before we begin, we would like to recognize the traditional territory where the main office of HEC is located, on the unceded, unsurrendered territory of the Algonquin Anishinaabe Nation in Ottawa. We recognize the enduring presence of First Nations, Inuit, and Métis people across this land, and the privilege that we have to live, work, and play on these lands. We know that many of you are joining us from across the country and ask that you take a moment to reflect upon the territory and its original inhabitants where you reside. Healthcare Excellence Canada is a newly amalgamated organization that has brought together the Canadian Foundation for Healthcare Improvement and the Canadian Patient Safety Institute. We are committed to improving the quality and safety of healthcare with and for more people across Canada. In today's session, we are focusing on the foundational principles of policy guidance to safely welcome the presence of essential care partners in health and care settings. The three principles include distinguishing between the roles of visitor and essential care partner, recognizing the valuable role that essential care partners play in the care of their loved ones, and engaging with patients, residents, families, essential care partners to develop and to implement new policies and practices. Please note that throughout this presentation, you will see us using the term patient, which is really meant to also include residents, clients, those that are receiving care. The policy guidance that we refer to has been co-developed together with those that make policy, those that implement policy, and those that are most impacted by policy. Together, we created the ideal journey to enable essential care partners to be physically present with their loved ones in the health system. Based on this journey map, policy guidance focused on two key areas: the identification and preparation of essential care partners, and then their entry into facility. And within these two key areas, there are 7 elements to implement, as noted on this slide. Underlying the ability of organizations to implement this policy guidance are these foundational principles. And the first is the ability to differentiate between a visitor and an essential care partner. A visitor is someone who plays an important social role in the lives of the patient, but does not necessarily participate as an active partner in their care. An essential care partner is one that is designated by the patient, resident, or client, and they may include a family member, a close friend, or another caregiver. An essential care partner provides physical, psychological, emotional, and/or spiritual support as deemed important by the patient, resident, or client, and they may actively participate in supporting decision-making, coordinating care, and providing continuity of care.
Reports have indicated that essential care partners and informal caregivers account for billions of unpaid caregiving that benefits not only their loved ones, but the greater healthcare system overall. This is care that is provided in the home, in the community, in primary care and hospitals, and in residential and long-term care settings. And the evidence is clear on the benefits of family presence. Caregiver presence directly impacts the physical, psychological, emotional well-being and safety of patients and residents, reduces harm, and improves outcomes and care experiences. In hospitals, it has also been linked to fewer readmission rates, fewer medication errors and patient falls, and improved cognitive functioning among senior patients. Similarly, the evidence to date in the long-term care sector also demonstrates family presence to positively influence the quality of life of residents and the quality of care they receive, with improved physical and psychological well-being of residents, reduction of costs, increased protection of physical and cultural safety, reduced rates of depression and social isolation, and reduced behavioral symptoms among residents with dementia. The presence of essential care partners also allows for improved communication and quality of information shared and contributes to better staff morale. A fundamental premise of a healthcare system that values patient and family-centered care is the engagement and partnership together with patients, families, and caregivers in the design of programs, practices, and policies. While the literature continues to emerge related to patient engagement and partnership at all levels across the health system, noted outcomes have included improved organizational culture, improved care, improved experiences and outcomes for patients, caregivers, and providers, better adherence to treatment regime, and lower healthcare costs. Ensuring all partners, including patients, families, and caregivers, are involved in meaningful and intentional ways to co-develop policy moving forward will ensure a more comprehensive approach that balances the many risks and harms that need to be considered within a patient and family-centered and partnered healthcare system. Many of the changes to family presence policies at the outset of the pandemic were not done with the involvement and engagement of patients, residents, families, or caregivers. Bringing in the perspective of those most impacted by this policy change will help to support a more balanced approach to recognizing the many risks and harms that need to be considered. Patient and family-centered care, or partnered care, is an approach to the planning, delivery, and evaluation of healthcare that is grounded in mutually beneficial partnerships among healthcare providers, patients, and families. Developing and implementing policies that support the integration of families and caregivers into patient care can be understood as a practical approach to operationalizing patient and family-centered care, or partnered care. The three foundational principles of Essential Together: distinguish between a visitor and essential care partner, recognize the value of caregivers as essential care partners, and engage with residents, families, and caregivers to develop and implement new policies and practices. All of these are person-centered practices, and all are foundational for the successful reintegration of essential care partners into healthcare organizations.
Essential Together is an open access, evidence-informed program that is freely available to all health and care organizations to support them in the implementation of the policy guidance to enable the safe reintegration of essential care partners. If you're interested in learning more, please check out our website where we have a number of curated tools, resources, and learning modules to support your work. Join us on social media and learn more in our newsletter, or email us. We would love to hear from you. Thanks for joining us in this session today.